Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome, everybody, to the Medical Collective. This episode, we're going to talk about men's health awareness, and I have Dr. Leslie Ann Williams and Dr. Dan with me. How are you guys doing?
Super.
Doing good?
Wonderful.
I mean, I can't believe it's already November. There's so much going on, but I guess we have to talk about the men and your health. But before we do that, I wanted to talk about current health news. And one of those is the whooping cough. I feel like when I was in medical school and training, it was one of those things you heard about but never saw. But now the amount of cases that we're seeing has gone up. Last year, there was about 4,000. Now we have over 20,000 cases of whooping cough. And up in the Washington area, there seems to be a lot more cases as well in Washington State. So, Dr. Dan, you're in the ER. Are there any tips you can give to people? And are you seeing cases?
Yeah, there have been cases, especially in the kids that have been coming in, even adults with persistent coughing. It takes an index to suspicion. Most people have been vaccinated, or kids at least those ages, but a lot come in with just chronic dry cough. Now, cough can be asthma. It can be just due to them just having a dry throat, or allergies, a change in season, weather, flu. So there are many other things to think about. But with regards to whooping cough, these are coughs that's persistent, literally. They're like literally coughing. And sometimes they're back to back to back. And when they're in those worst cases, which we're not seeing, at least in this country as much, they have this whoop where they actually kind of do that. And that's the whoop of the whooping cough. So if you're familiar with it or from other countries, you may have been exposed to it or know about it. But we see a lot of the bronchospastic cough. That's the one where you just have spasms and you're just coughing, most to the point where they actually throw up. You should probably see your doctor. They'll check you for pertussis. There's treatment for it. There's antibiotics, which is Zithromax or azithromycin. They usually use that. And sometimes they give it preventatively to some of the family and close contacts and those at risk. So you can look up those on the CDC website or talk to your doctor and they'll be able to go over some of those things with it. But we're seeing those cases. And in the advent of COVID and the lack of vaccinations and other things, so we will see more and more upticks of these things.
One question I have for both of you is when we're talking about respiratory distress, I get worried. If you know, I did have a friend that just lost their child to respiratory distress and asthma. And when is like the time or point of no return where you need to take your child in right away or be concerned?
Yeah, I mean, certainly if you notice that your child's having difficulty breathing, right? I mean, if they're sick and they're coughing, but it's intractable, meaning it's not stopping, or you see that when they're breathing, they're using more than just the normal through their nose breathing, they're using their stomach muscles, we call accessory muscles, to breathe. And if there seems to be labored breathing, I would immediately take the child to the emergency room. I would skip urgent care altogether, really, when it comes to children and respiratory distress. If they're turning color, it's a little late then, but you still need to get immediately to the emergency room. But I look for accessory muscles. If you find that I can't really reproduce it, but you see breathing happening in this little notch here or in their ribs. You see that they're really using their stomach or their accessory muscles to breathe. Then you want to take them in right away. Of course, if they've got fevers and other things, you want to immediately get that addressed too. Dr. Dan?
Yeah, I agree with all of that. And those accessory muscles are the muscles just around your ribs, your chest, abdomen, as Dr. Leslie mentioned. And if it's going fast, moving up and down or seesaw type movements, some of the younger kids, they do the head bobbing while they're trying to catch their breathing, or their nose is flaring, lips turn a little bit blue, purple. That's really bad. You need to get in. And if they're just struggling, don't pass go. Let them check your child out. These are the same kids or parents that also end up dealing with, God forbid, SID, sudden infant death syndrome, because they actually ended up, they're like, oh, well, he's looking okay, but they weren't sure, but they let them sleep. And then, God forbid, some of these kids end up dying overnight. And then you just hear the wailing in the emergency department. We already know what it is because you hear them crying, screaming, like, my child, and you know something bad done happened. So don't pass go, as Dr. Leslie mentioned. Make sure you get your child checked.
Okay, on a lighter note, we're in November. Some of us are celebrating Thanksgiving. The holidays are coming. And I wanted to give maybe a couple of pointers for people. People eat a lot during the Thanksgiving, and I think it's one of the busier days for the ER. We want Dr. Dan to stay out of the ER, not as busy. So what are the top 3 things that you see, Dr. Dan, in the ER for Thanksgiving?
Stomach upset. They come in with my tummy hurt, my belly hurt. Well, you ate too much. Ain't nobody asked you to eat that much. I mean, that's what really happened. Or food poisoning on the real. Food poisoning. You kept the turkey for 3-4 days, maybe even 7, and you left it out for some reason. You want to make that extra turkey sandwich. I understand sometimes it is challenging. We got inflation, real talk, and families are struggling, but there's certain things. Don't cut corners on that. Or they make a trip because they have some vomiting and diarrhea, they get sick. So we see a lot of that. We also see a lot of abuse during this time because either they're at some relative's house or something, and something is going on. Make sure you know where your kids are. And that's another thing. We see a lot of assault, a lot of abuse, sexual and physical. They're at uncle or their aunties or something, or some neighbor. Please don't get distracted by the family members, and make sure you know who is around your child. So that's one of the top things we do see. And of course, the regular things after the Thanksgiving, over the holiday, their child was sick or the family member was sick or the individual, they waited, they wrote it out. And then they come in on the next day, which is usually the highest day of volume we see in the emergency department after a holiday. And then everybody's like, oh, now you got to fix me. Everything's an emergency now. Well, you could have come in a little earlier, right? Just be careful.
The other thing I wanted to also mention, because as a hospitalist, I was always admitting people who had decompensated heart failure, blood pressure now out of control because you ate that salty turkey and you ate that salt that somebody put extra salt in food, went over your limit or what your doctor told you need to consume a day. So you have decompensated heart failure, and some people end up in the ICU, or their blood pressure is out the roof. Because, of course, they traveled, forgot their blood pressure medicine, ate all that salty food, and then their blood pressure goes up. So if you are traveling over the Thanksgiving, pack your medicine. Before you pack your underwear, pack your medicine. You know, you can walk around without some underwear, but you need your medicine. Or
do both.
So you don't want to do that.
And same thing for those who have diabetes and any other medical problem for that matter. Anything that you have that can be an emergency, have your medicine. Don't overeat if you're diabetic. Make sure your sugar is well managed. There's another thing we see, lots of low sugar or DKA, diabetic ketoacidosis, where they come in with their sugar sky high and they look like they have appendicitis and are in shock and sometimes can have brain injury from that. So it's not something to play with. But have fun, enjoy, but everything in moderation and know your risk.
Yeah, and know what you can cook or what you can eat, because a lot of people try to eat things that they may be intolerant to, and I think they should wait. Food safety is important as well when you're cooking food. My brother and them like to deep fry turkeys. And I've seen a couple of times where I'm like, that could have been like a house fire or very, very serious. So when you try to fry the turkeys, maybe leave it to somewhere else or make sure you're safe. Don't walk away from frying it, because I've heard of some disasters with that. So thank y'all for that. And have fun. Have fun this Thanksgiving. Try something new, healthy. Work out like Dr. Dan. Keep your medicine close to you, and try not to eat something that is going to get you into trouble. So thank y'all for that. All right, we're off to men's health. We don't talk about it enough. And I'm glad that we have you here, Dr. Dan, because I didn't actually even know it was Men's Health. I know there's one in the summer, but Men's Health, or what they call it right now, is the Men's Health Awareness Month. And basically, they're looking for preventable health diseases. What can we inform and educate, and mental health as well, I think is so important. One of the things I wanted to talk about first was prostate and colon. We'll put them together, but they're separate. Prostate health, only because we're seeing again in some communities, they're disproportionately affected by prostate cancer. They come still later than normal, and we have the screening necessary, but people still, I don't think know how important it is to get your prostate screening. I lost 2 uncles to prostate cancer, and it hits home when I know, oh my gosh, if I would have known that they did not get their screening when they needed to, it would have been necessary. So what would you like to say about that, Dr. Dan?
I think it's also personal for me as I'm getting older myself. And even at the youngest of ages, it's important to kind of figure out what's important to your health. So with regards to prostate, for men, it's important to get yourself checked. Your doctor will do what's called a PSA test, or prostate-specific antigen test, and they check that level. If it's high or elevated, they'll do further tests and may need to refer you to a urologist. You may have had symptoms that started off that you should probably be aware of. If you're having difficulty urinating, or having a lot of dribbling, meaning you're not able to finish your urination, or you can't even start it, even sexual dysfunction. I mean, any number of those things, you have to consider that. Yeah, this is the one where the doctor tells you to bend over, and they do check you and see if there's something enlarged. So get to know your doctor before they do that. But all jokes aside, I think it is important to make sure you're getting yourself checked with regards to the prostate. There are surgeries and procedures that can be done, and some things, actually even exercising your bladder and certain types of things, can help reduce the stress of prostate masses or just benign growth, meaning it getting enlarged. It might not be cancer, it just might be that it got a little bit bigger in size and things like that over time and age. So check on all of those things, but it's something that is preventable, especially for the prostate cancer and the death. So if you pick it up early, it's very important. Definitely affects African-American men more so than the regular population. So that's important for us to be aware in our own community and to talk about. In your barbershops, after the game, hey, you go get checked. Family members, loved ones, you can persuade your loved one to go get checked. So I think those are all avenues, even churches, mosques, wherever your religious worship, we have to address these things where people are.
I agree. I think my main question is, are we doing enough? Are we normalizing it enough? So Thanksgiving's coming up. We get around the table with our family members. Are we asking about our family history? That's important because a lot of us know if you have a family history of colon cancer or prostate cancer, your screening may look differently than someone that doesn't have those risk factors. Are we encouraging our family members or our parents to go to the doctor? Are we talking really at barbershops? Are we educating on social media instead of doing those cute little videos? So my question would be, are we doing enough? And are there things that maybe we can even encourage our colleagues to do as well, as we are, healthcare providers and influencers, so to say?
I think you need to determine what is enough. What constitutes enough, right? Because we are, as physicians, educating patients and encouraging patients to educate each other. And you can do all that you can. It is left for people to then follow through. And so does the lack of follow through then constitute not doing enough? I don't necessarily think so, because the adage is you can take a horse to the water, but you can't make the horse drink. Well, I think it applies. There is no lack of information today. There is no lack of information. No one can say that they didn't know. I mean, children are on there Googling how the baby came out, right? And so the information is out there. whether the motivation to actually get the testing done is a whole different thing. And we have to delve into the why of that, right? Is it because of fear? I have a dad who doesn't like to go to the doctor, and he doesn't go to the doctor. And his thing is, the doctor's going to tell me I'm dying already, gonna die, so why do I need to hear that anyhow? It's a mindset that I don't understand, but I hear it a lot. People just don't want to know. They want to live, and they want to live in bliss, ignorant bliss, if you will. So the question of, are we doing enough, is the question then is, what is enough? And does the outcomes reflect a lack of effort on the part of those who are putting forth the information?
Yeah, I think it goes a couple of ways. I think that's part of it. I think also providers, we as providers, have to do a better job of not just access, but people still have to trust us. And I think we'll remember, as we dealt with during COVID and other things, we had to build. And on the trust that was lost, I think they have to feel comfortable with their provider. And that will probably help solve some of the problems. So they'll come back and be able to have those conversations. But from a male perspective, we don't like going to the doctors anyway. Shoot, I don't even like going to the doctors. But I mean, at the end of the day, once we make it, we normalize it. I think what you're all saying, like maybe over Thanksgiving dinner, families, loved ones, those are the drivers that can push us to go get checked. And some do want to get checked, but maybe they had a bad experience, or they didn't know what the expectation was. I didn't know the doctor was going to do this, or I didn't understand what the doctor was saying. When they start speaking in their medical jargon and not talking to me like an individual, or not understanding where I am to be able to explain that, or I didn't have enough time to go over it with me. So I think those are parts, at least on the healthcare provider side, that we can do. And then the onus is also on our fellow brethren to also get checked, and for all the family or the support systems around them to be motivated enough to push them to go get that done for the greater good. We want you around. We want you to help the species survive, and the family and relatives and things like that. So I think all those matter, and we have to make those arguments.
I agree. I don't think enough people can hone in on the importance of healthcare and screening and heart disease. I tell my children the same thing over and over and over again. And a friend can come by and say the same thing and it sticks. So I think sometimes we can continue to say things and eventually maybe it'll stick. And then the last person that says it, it'll change. I think influencers can do a lot. A lot of influencers have been sharing their cancer journeys that we've been seeing more so than ever before, to be honest. And sometimes that puts a perspective on people that we can't give. So they listen to that. Something else that I do hear, and this is anecdotal, is that doctors don't tell me to work out. Doctors don't tell me to eat healthy, because for men, we know that, first of all, heart disease, it is the leading cause of death in the United States of America. And men, your life expectancy is 4.5 to 5 years less than women counterparts. And so we've got to think about what can we do to get that discrepancy out of there, and what can we do number one, on the accountability part. I think that's part of it. When I hear patients say, doctors don't tell me to stay healthy, I wonder if it was said to them, but they didn't hear it. I think that's part of it, and we've got to have this accountability factor. But I'd love to hear your thoughts, because I'm not a front-facing physician.
I think it's not that we don't say it. We don't always say it in terms that patient understand. One of my biggest pet peeves is speaking in language that the average non-medical person does not understand. A patient may not know what the word biopsy means. We know, we say biopsy all day long and we're comfortable with it, but if someone didn't graduate high school or something, they may not know what that means. So I think it really helps to explain things on various levels, and understand that people have different learning styles. Some people are not auditory learners. So you can tell them all day long, it will not register. You draw a picture, light goes on, they'll get it. So as physicians, we need to start incorporating the learning styles, right? I'm a former educator. Well, always an educator, right? But incorporate the learning styles in your demonstration. So I would talk about, okay, this is what's going on with your heart. With a dry erase, while I'm saying what I'm saying in very broken down terms, drawing it so that they will get it. And I would always send them off. You know that paper we use on the on the exam bed? Sometimes I would draw on that paper, tear it off, and that would be what I send them home with, so they have a visual of what we just discussed. So I think we have to remember that we're talking to patients, we're talking to non-medical people for the most part. And even if it's a medical person, they may not be in the same field. So a radiologist may not necessarily catch all the lingo from an endocrinologist, and vice versa. So break it down in small, chewable bites so people can fully understand.
Great points. So we talked about cancer and men in general going to the doctor. Some more stats I wanted to share with you guys. In addition to what I said about the age expectancy. So the life expectancy for men is around 76.2, and for women it's 81. 12% of men over the age of 18 are in fair to poor health. That's something to take into account. And some of the things that have been brought up, and there's an organization, is a whole movement for November. It's called Movember. They're saying that men not openly discussing their health and how they're feeling is something that we need to address. Men engaging in risky activities that threaten their health and understanding what they can do. And I also think knowing what you can control and what you can't. Lifestyle changes are so big. 50+%, and we've seen in many studies, 50% plus of cancers are preventable. Heart disease, leading cause of death in men. Lifestyle, exercise, diet, avoiding tobacco, which everyone should be avoiding tobacco, are things that I don't think we can say enough of. And I think putting it into terms, like you said, Dr. Leslie, is one of the most important things. One of the things that's not talked about enough, Dr. Leslie, is mental health in men, since we're talking about men's health awareness and the stigma around it. First of all, it's not normalized enough in general for women and men, but for men in particularly, depression, anxiety are things that aren't talked about. I've seen more groups discussing it, but what can we do to encourage men to kind of break down the stigma around mental health awareness?
I mean, we're talking about a whole societal culture, a culture where men are supposed to be strong, and the definition of strength is so abnormal in a sense, because for someone to show emotions as a human being is sometimes considered abnormal, which is just abnormal because men have emotions just like women do. And unfortunately, we are in a world, really, it's not an American thing. We're in a world where men are not encouraged to really honor whatever they're feeling and address it and share and be vulnerable, be vulnerable. I think it's very important. I know quite a lot of men who went off to college and decompensated, and there was no catch for them. There often isn't. They can't go with their guy friends and say, hey, man, I'm feeling some kind of way. It's not that kind of a community for men usually. And so I think it has to start with our sons very young. We have to, in the home, normalize talking about emotions. We have to, in the home, validate the emotions that things that our sons may be experiencing. And we have to also recognize that there are times when therapy is needed, and not have such a negative attitude towards therapy. In fact, I think everybody needs therapy, okay? Everybody needs therapy, some more than others, right? So therapy is a normal thing. But then when you get into the pathology of the mind, a psychiatrist is needed. But, let's talk about in Trinidad, where people with mental illness end up on the streets as what we call vagrants. And they are marginalized, they are talked about in a negative way. And even the place that we have in Trinidad called St. Anne's Mental Health Hospital, people make jokes about it. Well, no matter what, you're going St. Anne's, and it's nobody wants to go to St. Anne's because that's for the mad people. And there's such a negative connotation because we don't understand that, but for the grace of God, it could be us, or but for a switch in our DNA, it could be us. And so we need to, number one, change our language around mental health. Secondly, we need to embrace and be more compassionate, about people who are going through mental illness. They don't take their medication sometimes, and it's because they have poor insight. You don't get mad and, blame them per se. There are just so many negative attitudes around mental health that we have room to grow, right? But I think in the home, starting off in the home, normalizing, talking about emotions, right? Being open and feeling safe to be transparent. I think that starts in the home. The home should be the safe landing space, but unfortunately, that's not the case for everyone, right? Not everyone has a functional home, and oftentimes a lot of the dysfunction in our minds stems from the dysfunctional home. So it's a conundrum. It's a conundrum, but I think starting the conversation, and as physicians, always asking, always broaching the topic, always being comfortable to be vulnerable. I have never found my willingness to be vulnerable with my patient to be a negative thing. If anything, it has humanized me to them, but it's also made them more comfortable to show their humanity to me. And I think once you do that and there's that connection, there is a road now that opens up for healing.
I'll tell you a couple of things, Dr. Dan, because I'd love to, hear your thoughts as we go into mental health in men. Dr. Leslie was, pointing out that we have mental health. And I think the word mental health and illness are being interchanged. That same thing as physical health, cardiovascular health, right? There is a balance that we need to have. So in order to have that balance, whether you're in shape or not, if you need a trainer, you need a nutritionist, it's okay. If you need a therapist, I agree. Normalizing that, especially with men, is so important because there's this hesitancy when it comes to mental health or mental illness not to want to go. And I'll tell you this from seeing it from the other side with a family member is that I can see when it comes to regular health, I don't see, like with my father, I don't see why they don't go to the doctor. But when it comes to mental health, the system is extremely more difficult to navigate than it is for general care. And so I can see the fear in men in particular wanting to share if there's something wrong with pathology because it's not easy to navigate. It's not easy to find a psychiatrist. The inpatient system is a bear to deal with. And so it's very concerning to me that the mental health system in healthcare is the way it is because it makes it even harder for people to want to go and get help and seek advice when it comes to your mental capabilities or stability. So that's one thing. Another thing I wanted to share before we go to Dr. Dan is just about some of the stats around mental health in men and including when we get to the severe or the suicide. And sometimes that can be a mental illness. Sometimes that can be from depression or anxiety, is that nearly 12 men lose their lives to suicide every day. Approximately 4,200 of those suicides happen each year. And in the United States, the rate among males, and particularly Caucasian males, is 4 times higher than that of females. Male deaths represent 79% of attempted and completion of suicide. So just some thoughts as well. But Dr. Dan, off to you.
Yeah, this is definitely a challenging topic, and it's challenging more so because recently I lost a friend who I went to med school with, and I'll leave it at that. But I don't know from outside, and as anyone looking from the outside, you can say it's perfect family, perfect everybody, and perfect everything, perfect family. And I want to pivot from that to say, if that happened to him, who from the outside looking in, you're like, oh, everything's perfect, couldn't want more, beautiful family, everything. And without going into the details, the point is, it caught me off guard, caught many of our classmates and friends off guard. It's like, no way, like what, why, how, when, what was going on? Like nothing. So I say all that to say then, and it's a Black man. So as a Black male, but even just males in general, we have societal norms. So while those are changing right now, it's a different story. But the societal norms, at least the way I grew up, so I'll own my own thing, we're the provider. You are the male. You're going to go hunt and go feed, provide. And you have all the stresses in the world. And for someone to be successful, you have many things pulling you left and right. It is important for us to check in with each other. And as brothers, as men, we don't do that as much. If there's anything, we do check in with each other, but the check-in is more like, hey, what's going on? How you doing? Or what's going on? We hanging out today, or we going to go play golf? We playing basketball? We going to a lounge, or we're doing something? And nowadays, well, for me, it's a little bit different. Hey, we going to church or whatever, but still those things are still there in the background, but there's no checking in. Like really, how are you doing? We have so many masks. Yours truly too. I'm not perfect. Got my mask, but everybody does have their mask. And in that mask, everything's great. Oh, we killing it this way. We killing it that way. We're doing this and doing that. We can't show any chink in the armor. And we have all that burden. And sometimes that burden is too much that even the people closest to us don't know what's going on because nobody checked on them. Or maybe they did check and they just felt that responsibility and just holding it in. So I say all that to say from male health, since that's what we're focused on, and we're talking about this whole mental health thing, sometimes we're just a couple of steps from that brink to be pushed over the edge. And honestly, I mean, I've thought about some things in my past too. It's just if not by the grace of God for me and for some others, that's what keeps us going, or the love of a family or something new that kept you from that. So it's not something to take lightly, and it's not something to make people feel bad about it. It's not something that should be taboo. We should start to normalize it. So check in with your folks. Ask people, how you doing? No, how really are you doing? And for the males, please check in on the brothers. The sisters, the women, check in on your males. And if you're of a different orientation, check in on your male person. People aren't really looking and checking in on the males. Like our responsibility is go hunt and provide. And we go do that and we do more. But we're dealing with a lot of stresses.
You know, you said something that really got me to thinking, and when you talk about the masks, because we've become such experts of masking, right? Masking under masculinity, right? And we stay busy. People stay busy so that they don't face what is really going on inside of them. And I love what you say about men really creating a huddle get with your boy, or your guys, and you all get together. Women go on these trips all the time, these self-care trips, and we're going to the spa and we're doing all of these fancy. Listen, brothers, get together, go on your trips and bond, like for real, for real. And, I've always paid attention, right, Dan, Dr. Keisha, when people say, "How are you doing?" And before you can answer, they're down the street. Like, did you really want to know how you're doing? So what I do now is say,
it's a rhetorical question now.
Yeah, it's like, how are you? I said, do you really want to know? And if okay, well, let me tell you how I'm doing. And if I ask somebody, how are you doing? Like, how are you really doing? And I was like, oh, I'm going great. Really? Are you really doing great? And engage, because like everybody's just walking around afraid to unveil. And they're wearing these, now the masks are really, really sophisticated. Right now, we do LED masks and stuff. You know what I'm saying?
So one of the arguments is among guys, it's like, okay, so we're hanging out. We're just trying to have a good time. We really don't want to hear about your personal problems. To be perfectly honest, we just want to have a good time. So if we're playing ball or we're hanging out at the lounge, it's not where you want to unload, she's driving me nuts, I'm about to get a divorce, or the kids are acting crazy, or I don't know what's going on with my job, I lost my job, all these things that weigh on you can be challenging. So you really have to have a good circle of real people, of real friends who actually give about you. And if they don't, then it's superficial and nobody wants to hear that. But yeah, you have to really tap in and really check in on folks, because literally, what I told you happened, that was a shocker. Like, it made me start to ask that question, and within our group to say, we need to do better. We need to start checking in. Yeah, we'll ball, we'll play, and we'll do all these things. But are we really checking in during those times? Is it that we bragging like, oh, I just got this new ride, or I just did this, or whatever? Maybe that's not what we should be doing. We can do that, but we need to tap in. So how are you really doing? How's your marriage? How are your kids? How are you? How's all these nice stuff that you got going on? Or how's your stress life? I may not be able to help you financially or emotionally, but maybe I can be that friend and provide a resource and say, hey, this is where you need to go, or call attention to all the friends in the group so everybody can intervene and help. So those are some of the things we have to think about, really.
And just to add on to that, I think we want these friends that are the end all and be all. Early on in my marriage, I would come home and want to talk about work. And one of my friends was like, you have to have a place to talk about some of the things and not bear it all to your husband. So I think sometimes we need to find out, yes, we can have those friends we play ball with. We can have those fun friends, but we do need to have those friends that we can bear it all with, but also know when to not give it all to them all the time. And I think the other part of the check-in is, I think it's actually great that you're here, Dr. Dan, is that you're here talking about, as a man, about men's health, but you're the ER doctor. And sometimes that's the only place people go and see a doctor is when it's urgent. And so what can you do, or what do you do to check in on people, whether it's to tell them about, general health concerns that they're not presenting to the ER, or their mental health?
Yeah, it can be challenging because, one, I don't have a lot of time. And
right.
They say doctors don't have a lot of time. Well, I'm really in the emergency department. Like, I got fires I got to put out. Yeah, I heard the other one that just went off earlier today. But literally, the fires do occur. And, hey, there's a gunshot wound here. There's somebody who fell out the window here. This one's having a seizure. This one's got a fever. This one needs a school note and needs a work note, and then go to work. And they were just being lazy, but they just came to the ER so I can write them a note. So those are the life issues that occur. So I'm trying to address these things, and then you have somebody who tried to hurt themselves, or overdosed on a drug, or actually tried to take their life by strangling themselves, or gunshot. The gunshot ones usually are the males, and they usually actually completed or almost completed, as some of the stats you actually shared with us earlier, Dr. Keisha. So that can be challenging. That requires resources. So we usually have a multidisciplinary team. So it may be something where I'm calling in the chaplain and social work and say, hey, this person is going to need your services, yada, 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 in addition to getting psych involved, which is our psychosocial workers or actually a psychiatrist. Or a psychologist, depends on who's available and the timing of the day. And then actually having the real human conversation, empathetic. It's not like I'm just like, oh, pass you off to somebody. We have the conversation, and I can tell. I mean, we interview for a living. That's what we do. We can tell by people's body language, by their tone, the way they speak. Are they engaging? Do they seem frustrated, or are they just dejected? It's like an empty, hollow person you're talking to. What it is and who came in with them, or did they come by themselves? Did they come by ambulance? So there's so many different factors that goes into that. So I have to analyze that, decide what I'm seeing, and then ask the question and see what the patient wants to give me. Are you forthcoming with the information? Are you telling me you felt like hurting yourself? So why did you want to do that? Or why did you do this? And if they're ready to divulge, I hear them. If they're not ready to divulge, I engage all those services. So they're there, and we go touch base with each other to kind of understand that, and then provide them with resources. That's as much as I'm able to do, or my limitations within the ED, and that's just what it is. A little bit different from the personal circles, but with the patient encounter, you got to provide them all the wraparound services you can, the best I can do.
Yeah. You know, as we're talking about this, I just a couple days ago, it came to my attention, a young man who was a former NBA player and former star at a major university, who was on social media and essentially decompensating what appeared to me as someone who was having a mental health crisis, or I don't know if he has mental illness, but he was having a mental health crisis. And, you know, there were tons of responses. And, you know, of course, I'm concerned. I'm like, can someone go check it? Like, someone needs to go. Don't send the police, because they aren't often able to really manage a mental health crisis. That's not their training, okay? So someone of his friends go, you know. Anyhow, so I was just reading an update, and the NBA Players Association has reached out, and, you know, these men are like swarming now to help this young man. It shouldn't get to that, though, because someone already knew that he was not in a healthy space or place. And oftentimes it's so difficult when people, whether they're diagnosed or not diagnosed, it's so hard to help them. It's so hard sometimes because you're fighting them. They are resisting you. And I don't know the specifics around this particular case, but my point is, it shouldn't get to the point where somebody's on social media now decompensating in front of the entire world. You know, that was very, 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 very sad to see. But we've seen a lot of this kind of a display, because people sometimes feel they don't have anyone, right? The stronghold of the mind is, there's no one. I'm here by myself. And so kind words, kind gestures sometimes are the turnaround for someone who feels like they're alone out there. You know, just thought I'd share.
Well said, Dr. Leslie, and thank you both. I hate that it turned, but this is very important that we did, and actually on mental health, men's health awareness, but everyone's awareness. I think it's a community effort. That's what I've took from this. Yeah, we started with heart disease. We started with get your prostate, normalizing screenings. But the real conversation is check in on your friends. Make sure there's a support system. And let's not wait till the cancer has spread to the heart disease is too far along until they're decompensating, like you said. Let's not. Let's take the warning signs. I'd love to hear, hopefully, some comments on our Instagram page about this and ways we can talk about this more in the future. But Dr. Dan, Dr. Leslie, any final thoughts you have on what we spoke about today?
Yeah, I would say also we didn't get to talk about colon cancer, so any other cancers, just go do your screenings. It's very important. It's just one of those things you got to get done, and it prolongs our lives. And as medicine catches up and technology and all this stuff, we'll be able to diagnose better and maybe cure some of these diseases, hopefully very soon. But in the meanwhile, do what you need to do to stay alive for you, your family, and your loved ones, and for the community. For whatever specific reasons you have. For me, it's for me, my community, my family, my loved ones, my God, and those are the things that I'm praying for my patients. So I need to be around, so I'm going to do all the screenings I need to do. I know the information, so therefore I know, now do better. We all have to do better. Learned a lot of things that do better can actually resonate in my ear, because I got a lot of issues I'm trying to do better with. So,
And you did. We saw the video of you, I think you posted when you were getting your colonoscopy. So
yes,
I think that normalizes it, and somebody's going to see it somewhere and be like, okay, I'm going to get mine too. So I appreciate that. Dr. Leslie?
If this big African man can get his colonoscopy, surely I can get my colonoscopy.
There you go.
Nausea to the world.
Now you're preaching. I love it.
Oh, but let me say one thing about colon cancer before you speak, Dr. Leslie. With the screening, yes, the age has changed to 45, but I do want to say something, please, people, that screening is one thing, going to the doctor is another. But for those that have low risk, you can get the over-the-counter. I'm saying this because I'm seeing more colon cancer that's younger than the screening age. And so if you're not having symptoms, if you're not having what we call inflammatory bowel disease or nothing, and you're not being followed by a GI doctor, you can get the Cologuard. And I have seen some people that have had a positive and then go to a reflex colonoscopy, and we found something. So you have tools at your bedside as well. Dr. Leslie.
In addition to the colon cancer, the prostate cancer screening, there are men out there, young men out there, who have forgotten that there are STIs, sexually transmitted infections, that are going around there. And they are lurking, waiting for you. Please be safe. Wear a condom. We hear the stories all the time. I don't like how it feels. It doesn't feel good. Listen. You're putting your life at risk. It's a temporary glee that now you may contract a lifelong disease. So please get tested. Gonorrhea, chlamydia, HIV still goes around. We don't really say go and get tested for herpes. But if you know you have herpes or you're getting the little bumps on your penis, don't go and have unprotected sex with someone and not inform them so that they know that they can get the little bumps too. Sharing in this case is not caring. So please take care of yourself, all of yourself, your mental health and your spiritual health. Okay? Spiritual health comes first in my books. Take care of your spiritual health. Make sure you're testing for your STIs and not sharing and swapping all of that stuff. And what Dr. Dan and Dr. Keisha, we all been talking about is the colonoscopy. And also, men, you do have breast tissue. Yep, you do. Yes. You do have breast tissue. And sometimes as you get older, they enlarge. We call it gynecomastia for a number of reasons. Check your breast too, because if you have a lump in your breast, you do need to get that checked out. Men do get breast cancer. So beware, be informed, and that's all I got to say.
I did want to quickly say, we forgot about the young men as well with testicular cancer, because as a pathologist, I do see quite a lot of those, and men are forgetting whether it's a swelling that's due to something else or there's just fluid in there, that testicular cancer is real. It's one, to me, also that can be caught early, can be treated in various ways depending on the type of cancer it is. But it's so important we don't, because I've seen many cases where they're presenting with an extremely golf ball, orange-sized mass. And we cannot let it get to that point, please. And one last thing is, there's one preventable cancer. We hear about women, right, in the HPV vaccine because we think that that prevents cervical cancer. It prevents head and neck cancer and penile cancer and anal cancer. So please also make sure that's the one vaccine that prevents a preventable cancer from the virus HPV. So remember that. It has been great and thorough. I hope you guys have a great day. And remember to stay informed, take care of your health, and we'll see you next time. Thank you for tuning in to The Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast